everybody, welcome back to my channel. So today I'm going to be talking about the healthcare visa routes for healthcare assistants and carers. Now, as you all may know, the Home Office has recently, or the UK government has recently accepted to put the health carers and people working in the care home under the shortage occupation. That is making them the only profession level 3 who are under the shortage occupation. Now, this was because of the need in the healthcare sector, and it has been accepted by the Advisory Commission. And a letter to the Professor Brian Bell on the Migration Advisory Committee. I'm going to show you a letter that confirms that this route is valid, because a lot of people are not sure if it's a very valid visa route or if it's not a valid visa route. Okay, so I'm going to be putting this letter on the side of this video, so if you want to read along with me, you can read along with me. So I'm going to be looking into my phone here, just so in case you see me looking down, that's the only reason. So it says, Professor Brian Bell, Migration Advisory Committee, 2nd floor, Peel Building, 2 Marsham Street, London, XW1P4DF, which is a postcode, 24th December 2021. Dear Brian, I would like to thank you and the rest of the committee for your annual report and for bringing forward your interim recommendation to add care workers and home carers to the health and care visa on the shortage occupation list. I welcome your recognition that the launch of the new point-based system has been smooth, and many stakeholders have praised the operation of new immigration system, finding it more user-friendly and efficient than the previous system. This includes the social care sector, who have made good use of the new health and care visa since its introduction. I wanted to inform you that the government has accepted the recommendation, including your recommended minimum salary of £20,480, the expansion of the health and care visa in addition of care workers to the shortage occupation list. It's a significant step for the government, as they would be the only occupation outside of the RQF level 3 eligible to use the point-based system. The government is making a decision in recognition of a exceptional situation faced by the care sector during the pandemic, and the strong evidence you provided to support the recommendation. As your report points out, immigration cannot be the only answer to addressing workforce issues in the sector, but we accept the recommendation. It could help alleviate some of the short-term difficulties posed by the pressure faced during the pandemic. Some employers in the sector have only very recently become sponsors, with the addition of senior care workers and other key health and social care roles at the launch of the point-based system in December 2020. And there is a degree of uncertainty about how they will respond to this latest occupation being added. The Home Office will therefore need to keep this measure under close review, and may also need to consider the position further when you publish your full report in April 2022. We are creating an initial 12-month time window whereby workers can apply for visas in this occupation. This will be reviewed internally at a later stage in 2022 to determine the success of this change. In relation to wider changes to the sector to attract and retain staff, and the position with regard to the impact of COVID-19. The Home Office will work with the Department for Health and Social Care to determine the best way to assess the impact of this change and whether it remains appropriate for care workers to be on the shortage occupation list. We are also taking forward implementing this recommendation in a quick time frame as possible. In order to introduce this change, we will need to amend the immigration rules, make changes to our IT system and guidance, and ensure case workers' readiness. We believe those measures will come into force in February 2022. I look forward to receiving the full report on the impact of the free movement on social care sector in April. With my very best wishes, yours sincerely, Kelvin First MP, Minister of Safe and Legal Migration. So that is a letter that confirms that workers in the care setting will be added on the shortage occupation. However, as you can see from the letter, these things will be enforced in February 2022, hopefully when the full report comes out. So I read this letter just to let some people know, so they don't get scammed, and so you can also prepare yourself ahead of this time. So this is like a 2-month period to prepare, read, study, look for the right employer, start applying, and look for the employers who have recently been become sponsors of visas, so that you can apply to the right people and get the right jobs when it becomes available. I hope this helps you to have an idea to help you prepare for these visa routes, and also for you to know the peculiarity of this visa and how you have to get it right and not to get scammed in the course of getting these visas. And I hope it did help somebody to confirm that this visa route is true and actually is something that you can look forward to in this new year. So the MPs are going to do all they need to do, change their IT systems like you've heard, because now they are bringing an occupation that is below a level 3 into the point-based system. However, it's something that they've accepted to do, and it's going to be for the short term. So let's just be hopeful that the full report comes in and it still tallies with the report that has been presented recently, so that possibly it is increased from just a 12-month period to maybe 24-month period or a 3-year period. However long it is for, I want you to be rest assured that if you get a visa under this route, you will definitely be getting a 3-year visa that can still be extended till 5 years. Or if you get a 3-year visa, you can extend it again to 5 years for you to get ILR. And also be rest assured that you can also bring your families into the UK via this visa route. So it is a working process which the Home Office is readily working towards, because obviously, like I mentioned in one of my videos, there are lots of staff shortages. Agencies, nursing home, care homes are short-staffed. They are paying so much money to get nurses to come and work for them because people are sick, people are becoming sick of COVID, people are going off work. Even in the NHS, it is massive. So it is really a pain for them all that they are having to spend so much money to recruit people. So if this is a way to alleviate the recruitment problems that they have, then the Home Office is doing its best to help them. And like you all noticed, it did say that immigration cannot be the solution to recruitment problems. However, for the interim, it is the only option that they have, and they are willing to lay it all down the table and get people to come work for them come in this year 2022. So we're going to be looking out for these policies that will be reviewed and the rules that will be changed in the immigration to enable people to get visas as carers and healthcare assistants in the UK. So hopefully by April 2022, which is usually the new year for the UK, economical new year for the UK, that these things would have been reviewed, and then these new rules would have been put in place as clauses for people to come to the UK on the health carer route, or people working in the care and social sector to come into the UK. And we are all looking forward to that to happen soon before the year runs out. I hope this video helps you to understand more those visa routes and helps you to prepare yourself before it comes into full force. If you have any questions, do it to ask. I'll do my best to answer. Thank you for watching. Bye for now.